This radio program is PG-13. Parents strongly caution some material may be inappropriate for children under the age of 13.
The following program is sponsored by Michael W. Smith. The views expressed on the following program are those of the host and not necessarily those of staff, management, or ownership.
Arizona, Brother Mike is back on the radio. Phoenix, yes. HardcoreChristianity.com. Thank you for tuning into the program. Today's Bible study, The March of Euthanasia. It's coming to America. Hey, will you call somebody and tell them radio program's on? I'll make some announcements while you make that call. Thank you for helping the ministry. You've been helping me for 21 years now. Very grateful for that. HardcoreChristianity.com is the website. All of our ministry services are on there. Please remember we have 2 live services every week, Thursday and Friday nights at 7 o'clock. We have 2 live Zoom healing and deliverance services, Mondays for the ladies only at 6:30 and Wednesdays at 6 p.m. for everybody. We also have a children's service that's coming up July 13th. If you have a preteen who needs prayer, that's Saturday at 10 a.m. in the morning on July 13th. We also have a healing service coming up on June 29th. That's Saturday at 6 p.m. at the Arizona Deliverance Center. I have a podcast every Sunday morning at 9 o'clock on twitch.tv. And we have free counseling services available to born-again Christians. If you have the need of seeing a counselor, you don't have any money, you can do so for free. Give me a call, 602-636-5800. I'll put you on the schedule. Send me an email, Mike at hardcorechristianity.com. I'll give you all the information about the services, the podcasts, and the seminars. Euthanasia. I did a radio program on this back in, I think it was 2002 when I first started. And I was warning everybody that I could about euthanasia because, you know, it's coming. It's coming. You know, right now, for example, in Europe, euthanasia is available in Belgium, the Netherlands, Luxembourg, Germany, and Spain. And an incident has recently happened where children of all ages can be euthanized in the Netherlands. A recent law passed in that country. They became the first country to legalize euthanasia. That was back in 2002 when I did my original radio program on it. And now they've legalized euthanasia for children at any age. If they're sick or ill or severely mentally ill or anything like that, in Netherlands, they have the ability to have doctors put them to death. Now, the difference, as you know, between euthanasia and physician-assisted suicide is pretty significant. Under euthanasia, it doesn't need to be a choice of yours. The state can make the choice for you. The country can make the choice for you. Here in America, we don't have euthanasia yet, but it's only a matter of time. It's only a matter of time. Physician-assisted suicide, as you know, started on the West Coast, Washington, Oregon, California. It has since spread to Montana, Colorado, Maine, Vermont, Rhode Island, New Jersey, Delaware, Maryland, and the District of Columbia, Washington, D.C. Those states now have, I forgot Hawaii. Hawaii has it as well. Those states now have physician-assisted suicide. That means if, for whatever reason, disability, injury, what have you, if a doctor, agrees, and you get the physician's okay, you're legally allowed to end your life. It's not euthanasia where you still have a choice. However, many states, as I'm speaking to you, are getting ready to enact physician-assisted suicide. In 2024, they're currently considering it. Alaska, Utah, Arizona, Wyoming, Nebraska, Kansas, Oklahoma, Maryland, Iowa, Minnesota, Michigan, Indiana, Ohio, Pennsylvania, New York, Maine, Massachusetts, New Jersey, North Carolina, Tennessee, Mississippi. All these states that I just mentioned are in the process, as I'm speaking to you, of currently considering physician-assisted suicide. And then the next step is euthanasia. That's the next one that's coming. You saw a little bit of it, in a way, already manifest in a less severe version. The federal government, Dr. Flippy, the National Institute of Health, the CDC, most of the Democrat Party, during COVID, had mandatory vaccination mandates. Mandatory mandates. Right? They said, listen, we've got to stop the spread of COVID, and if you get vaccinated, you can't spread COVID and you can't get it. That's what Joe Biden said, for example. The President of the United States got on television and told everyone that if you get vaccinated, you can go back to your normal life. You can't get COVID and you can't give it to anybody. And he got COVID after he'd had vaccine and 2 boosters. The whole thing was a crock. Then they started firing people in numerous industries. The airline industry, for example. The medical industry, hospitals, were firing people because they would not take the vaccine. Then they turned around and let in 10 million unvetted and unvaccinated illegal immigrants into the country. This was while they were mandating that everyone take a vaccine. Obviously, I never took the vaccine. I was using ivermectin and hydroxychloroquine when I got COVID, and everything turned out fine. The medication worked beautiful. But the point I'm trying to make is the federal government started to impose control over us and forced businesses and churches and agencies all over the country to close. And we later found out, in fact, just this month we're finding out, that all these things the government said to us, they were lies. Social distancing, masks, the desperate need to mandate vaccines, all of it was a satanic lie. They made up everything. But the point I'm trying to make is the government is trying to control us, and that ultimate control will eventually end up with euthanasia. Under euthanasia, if a physician or the state or the government decides that your condition is hopeless or incurable and you should not be around anymore because you're a drag on the medical insurance system or the medical health care system, if they decide that, you get put to sleep like a pet. And that's what euthanasia is. It's putting people to sleep. Now, granted, many people do want that of their own free will. Yes, they're tired of fighting and they don't want any more treatment. I fully understand that. Human misery and suffering is something I've been obviously involved in for over 40 years. I've been a professional counselor for over 40 years, and I'm used to dealing with people who are emotionally and mentally ill. I get it. I understand it. But when the government steps in to implement a program the program is always either immoral or it's malfunctioning. Right now, the federal government is trying to get abortion up to birth normalized so that pre-birth euthanasia can occur all over the country no matter what age the child is. There isn't anybody in their right mind that doesn't understand and know that an 8 or 9 month old baby in the womb is a fully developed child. Nobody doesn't believe that. Everybody knows that's true. But with pre-birth euthanasia, the federal government, again, trying to control our lives, is attempting to say, listen, you can put to sleep an infant in the womb, and in some cases, if it's born alive or aborted alive, you're allowed to leave the child on the counter while it dies, thereby putting it to sleep. I understand physician-assisted suicide. Everybody does. At some point, I feel so sorry for these people. They get so sick and they're so tired, they just want to expire. I understand that. Everybody understands that. It's all human pain and human compassion. But when the federal government steps in and begins to decide who lives and who dies, that's when we fall into the hands of Satan. Because every time the federal government gets involved in a program, that program malfunctions. The federal government of the United States is not capable of administering social programs. They're not capable of administering morality to the American public. They don't have those skills. They simply just can't do it. And with euthanasia now popping up in Europe and physician-assisted suicide now popping up all over the United States, it's only a matter of time before America allows it in all 50 states. The danger is here. The danger is real. We went through it with COVID and all the lies. And later on, we're going to do it when the government decides, hey, your usefulness or your drag on society, so to speak, is a certain point where you need to be put to sleep. See you next time.
The views expressed on this program are those of the host and not necessarily those of staff, management, or ownership. This program was sponsored by Michael W. Smith.